Would you like to do that, or should we get right to it?
Let's get right to it this time.
Okay. So I see our treasurer tax collector, Mary Zeeb, is on the line, and she has an update for us on her operations. Mary, can you give us an update?
Absolutely. Thank you, Maya. Mary Zeeb, treasurer tax collector here. Well, we're working very hard during all this. We have the property tax due date for the second installment is delinquent if not paid by the 10th, which is next Friday. Because of that, our office is open to the public Monday through Friday, 9 to 1. We're answering questions and taking payment. All of my staff is either working remotely, or the ones that cannot have been divided into 2 shifts that are reporting to the office at different times to help maintain social distancing protocols and also to provide relief. Our workload is steadily increasing as we approach this deadline, and I'm anticipating we're going to start seeing backlogs in payment processing. To that end, I strongly encourage electronic payments to be made by taxpayers via the web or the telephone. And as of today, our collections are on pace with those of last year at this time. And that's it. Thank you.
Thank you, Mary. And Henry Gonzalez, our agricultural commissioner, is also on the line today to talk about operations there. Henry? Henry? Okay, so we'll give him a minute to either unmute or get on the line. But I also see, yes?
So what if you know, just so we can kind of time things, if there are specific questions of the tax collector, maybe we could do that now, and then we go to the next type of subject briefing.
Sure. So again, if you have questions, you can use the raise your hand function, or you can send your questions in by chat, or just ask. Does anyone have a question for the treasurer tax collector?
Oh, come on. She's easy. She gets off easy, huh?
She does. All right, let me see. Is Henry Gonzalez on the line now? All right, if not, then Dr. Ed Moreno is also on the line, and he has an update for us today. Dr. Moreno?
Yeah, hi, this is Dr. Moreno. Good afternoon, everyone. So as we move further into this pandemic, we continue to receive specimens from patients from our primarily our 4 hospitals and some other, a few other providers. And we continue to run the testing here. We've not received any word that we're due to receive any additional testing supplies for our additional machines that can also run COVID-19 tests. But we are working with our vendor to try to get that as soon as possible. And we continue to receive test results from our commercial labs as well. And as of last night, we had 53 cases, excuse me, and 2 deaths. If you go on our website, you'll notice that as we get more cases, we're now breaking down the groups into more specific groups. Primarily on the beginning of the age spectrum, we've created I believe a 0 to 17 age group, but again, we are anticipating that if we get enough cases, we can start breaking up the numbers themselves. And on the other end of the age spectrum, we have 65 and older, which again is the at-risk population for complications of COVID-19. I can, if you like, I can go into what we're doing in terms of homeless individuals, unless someone from social services or EOC is on the line, and I can hold off on that.
Social services is not on the line today. Gary Millay from OES is on the line.
So then, thanks. I'll leave that up to Gary Millay then. We continue to have conduct our case investigations. People, that's basically, again, the people who have, we've confirmed that they have COVID-19, and also contact investigations, which is identifying people who are exposed and having them put themselves in quarantine, and checking in with them, especially those that are high risk for complications. And also the working with employers as the need arises to assist them in determining who in their facilities were exposed and who needs to be notified, so they can also quarantine themselves. Let's see. So went over lab, went over cases, went over, back to the cases. We've been able to look at the data of the number of cases that we have, and fortunately, I think when we first started having our cases, that was just about the time I was about to issue the health officer order for shelter in place. And at that time, even though there were small numbers, it looked like we were doubling the number of cases every other day. Once the shelter in place order was implemented, we're now seeing that the number of cases are doubling about every 5 days. So that's an indication that the sheltering in place order and compliance with the shelter in place, in addition to other measures, social distancing measures like school dismissals, has been effective at slowing down the spread of COVID-19 in Monterey County. So I want to really encourage those that are providing essential services to continue to provide essential services, but follow strategies for social distancing. If you're not providing a essential service and you're not involved with maintaining our infrastructure, then you need to shut down and you need to basically stay at home at this time. And with that, I'll hand it back to Mia.
Thank you, Dr. Moreno. You did mention some homeless issues. Did you want Gary Millay from OES to address that?
I was going to get into efforts that are underway for alternative care strategies, but Gary, who's the emergency services manager overseeing the Emergency Operations Center, has more details than I have.
Gary, are you on the line to speak to that? Okay, and he may join later. And go ahead.
I was going to say I can make a few comments on that. You know, we are still working on plans to address the homeless population, and it's going to be a multi-pronged approach, looking at not recongregating congregate populations who may be at risk and or actually have COVID-19, and establishing housing situations so that those who are have COVID-19 or are sick, and possibly even those who are at risk, so that they have the right housing, so that we can either care for them because of the COVID-19 that they may have, or to protect them from getting COVID-19 if they're an at-risk population. So we're looking at a multi-pronged approach, but we are going to try to shy away from just moving one congregate living situation to another.
Thank you, Charles. And I'll try one more time to see if Henry Gonzalez is available.
He's having a hard time getting off mute, I think.
Yeah, I think that could be the case, because I see he's on the line. Why don't we start? I see Pam Moreno from The Weekly has questions, so we could start with the questions now and see if Henry will join us.
Okay.
Pam, do you have a question?
Yes, I do, for Dr. Moreno. Are you tracking by race ethnicity? And have you noticed any, whether any race or ethnicity is being disproportionately affected, or is it running pretty concurrent with population stats? And would you consider reporting that out?
So that's a very good question. We do collect some demographic information when we make contact with the cases that have COVID-19. And race ethnicity is sometimes provided, but oftentimes it's not, and it's up to the individual if they want to share that information. So we may have some information, but I don't believe we have enough to report that out.
Thank you.
I'm not sure if we can hear, I can't hear May. I don't know if anyone can hear me.
I can hear you.
Okay.
There,
So-
sorry, the mute button's gone on the Fritz. I was hoping that Henry Gonzalez might have been able to unmute also, all of us being challenged.
This is Ron Keller from KION. I do have a question for Dr. Moreno too.
Yes, please go ahead.
Yeah. So a couple of weeks ago, you guys were talking about, the health department was talking about developing their own test for COVID-19. Has there been any progress on that?
Okay, yeah, thanks for the question. Yeah, so we have currently we have two sets of, in fact, we have one machine that can run, use the supplies that were provided by the CDC, and that's what we're currently using right now. We have, on that same machine, we can run another set of reagents and supplies, and we're holding off on that until we use the CDC supply. And we're actually hoping that we get more of the CDC supply. That's what we're hoping for. Then we have another machine that can run a different type of test. It needs its own reagents, and that needs to come from Cepheid, the manufacturer of that test. And today's Friday, and we still haven't. Our vendor has told us that they can't get any confirmation from the supplier about when we can expect to receive supplies so that we can run that test as well. So, but we remain hopeful, and we keep working with our supplier to try to get those supplies to us.
Did they give you any time? Did they give you any timeline?
No, they didn't. No, only that they're in short supply right now as well.
What is it that you're looking for exactly? What is it that what supplies are we talking about?
These are we have the equipment, the machine itself in the laboratory. When we receive specimens from the hospitals, we need to extract the nucleic acid from the specimens, and then we have to insert the samples into cartridges that then can be and put into the machine, and the machine then runs the test. So we have swabs, we have the specimens coming in, we have the machine. What we don't have is the reagents and the cartridges that we need to complete the test. So that's what we're waiting for.
Okay.
Maya, this is Mark Carbonero with iHeart. I have a question for Dr. Moreno.
Please go ahead and ask your question.
Of the 53 people that have contracted the coronavirus here in Monterey County, how many have recovered? How many are actually hospitalized? And when they're hospitalized, do you know what type of treatment they're being given, what drugs are being used, and what the doctors are finding is efficacious?
All right, let's see. So I'm pulling up our website now. Okay, so I'll take the last question first, and that is, right now there are only supportive measures for to treat the symptoms of COVID-19. So if someone is hypoxic, meaning they can't get enough, exchange enough oxygen in their lungs, then they require additional O2. And if they don't have enough strength to breathe, then they can become intubated. People who are very sick can't take anything by mouth, so they receive IV fluids. They may have fever, so they fever-reducing medicines. If they have any evidence of heart weakness or heart failure, they could be given medications to help strengthen the heart. But so these are all supporting the symptoms of the disease. Right now, we don't have a medication that's been shown to alleviate the symptoms or reduce the length of illness like we do with influenza. So it's still supportive measures at this point until a medication is approved and passes the trials and is approved for use.
Okay. Now, what about those that have intubated? Have any of them recovered, or those included in the 2 fatalities?
I don't have information in front of me about which of our patients have been intubated, but again, I can check with our epidemiologist about information regarding the patients that have been intubated. So,
all right, thanks.
Dr. Moreno, this is Pam Moreno again. On the test reporting, are the subjects, the specimens that are tested from other counties, is that work that you all are doing for San Benito County? Where are those specimens coming from?
Yes, so we do have specimens that come to us from residents of San Benito County. These might come from the hospital out there in Hollister, or if a San Benito resident comes to a hospital here in Monterey County and the provider feels like they need to be tested, those tests could come from one of our local hospitals. So yes, we are providing that service for San Benito County. I just remembering, I think, part of another question that about recoveries. So we are starting to put the number of people that have recovered on our website. So as of midnight last night, we have 5 people who we can confirm have recovered. And again, those are individuals that were confirmed and they have been determined to no longer be infectious.
Okay, so 5 have recovered. This is Mark again. So 5 recovered out of the 53, that leaves 48, then minus the 2 that died, that's 46 that are still infected, and we don't know, or can you address their health status at this time?
Well, as a group, most of those would still be in isolation because they're still considered infectious. And there could be others that are no longer infectious, but our disease investigators just need to update the statistics.
Thank you.
And how many are in the hospital?
We've had 9 hospitalizations, and that's also on our website. The other thing we started adding is under clinical information, we started adding underlying conditions. Again, when we get to at least 5 people, 5 individuals in a category, we can break that category out. So at this point, we have 17, the people that had been diagnosed with COVID-19, 17 individuals did not have pre-existing medical conditions. We have 8 people who had diabetes. And we're also posting the number of people who have been hospitalized. So I think I think it will be, I hope it is helpful for the public that goes to our website to see that here to not only hear from the CDC and the California Department of Public Health that underlying medical conditions put people at risk for complications. I think people need to people can see that we are having people with underlying medical conditions come down with COVID-19. And at this point, we've had of our cases, at least 8 have shared with us that they have diabetes. So people need, hopefully people will pay attention to that. Anyone who's got is over the age of 65 or has an underlying medical condition like diabetes or heart disease, lung disease, kidney disease, liver disease, or if they're immune compromised because they have poorly treated HIV, or they're in cancer therapy and they're on immunosuppressants or taking other immunosuppressants for other reasons, those are the groups of people who are greater risk for complications and death. And those are the people that really need to stay at home and stay away from people who are sick.
Is there a special reason that diabetics, or is it just, I mean, other pre-existing conditions I'm sure exist, but is there a reason that you identified diabetics as one of the pre-existing conditions of a large group? Is that especially problematic for a diabetic?
Yeah. So we know that people with underlying medical conditions are also more likely to have complications from other viral illnesses like influenza, and diabetes is one of those. So diabetics tend to have more difficulty fighting off infections. They are greater risk for skin infections and other types of infections. So I can't go into the pathophysiology of that, but it's consistent with as a risk factor. It's consistent with what we've seen in influenza.
Got it. Yesterday, Santa Cruz County had told us that they have 40 or 50 ventilators. Do you guys have a count on the number of ventilators available in the entire county of Monterey at every hospital?
So very good question. So the answer to your question right now is no. It doesn't mean that the information is not available though. So I can't answer the question today, but we continue to have ongoing discussions with the hospitals, and one of the discussion in an upcoming discussion, we do want to have that discussion of what resources we have, how many beds do we have, how many ventilators do we have, how many ventilators are not in use right now and need to be refurbished, and how long would it take to refurbish those, and how many ventilators would we possibly get from the state if we put a resource request in. So these are all important information that we would like to have. So we're going to be working with our hospitals to try to see if we can compile something on a local level. The hospitals are reporting some bed status to the state, but the best data that we can get will be data that we get directly from our own hospitals.
Thank you, Dr. Moreno. And Henry Gonzalez from our Agricultural Commissioner's Office has been able to join us. And before we take any more questions, let's let him give an update on his operations and efforts in his department. Hi, Henry. Unmute. Henry, can you unmute? See if I can unmute you here. Nope. Well, we'll let him work on that, or maybe if one of our operators is watching and can unmute him, that would be great. Are there any other questions for Dr. Moreno or Mary Zeeb?
Hi, this is Joe Sadowski over at the Salinas Californian.
Hi, Joe.
I was wondering, Dr. Moreno, you talked quite a bit about the testing and testing supplies. I'm curious, how many tests would you be able to run with the supplies you have on hand? And just want to clarify, is there any idea when you might get resupplied with those reagents and cartridges?
Okay, yeah, thanks for the question. So at this point, my lab director is not, when I checked with her, she was not concerned that we're going to run out of supplies. But we all know that the supplies are limited. So I don't have the actual number for you and how long our supplies would last because it depends on how many samples are submitted to us every day. So we are, you can see on our website how many tests that we've already performed. I will say that we have the capacity right now to run up to 80 specimens per day, Monday through Friday, fewer on the weekends. We haven't been running up to 80, and that's, I believe, primarily because the hospitals have been following the guidance that we've provided for prioritizing which patients should get tested. And we're still using the same criteria that we used last week, which is prioritizing individuals who are being admitted to the hospital, and it's primarily so that the hospitals will know who has COVID and who they should dedicate their negative pressure rooms to, and also to make sure they're only using PPE for people who are suspected or confirmed COVID-19. And if they test negative, then they can release them and use that PPE for another patient.
Right.
So that's the other population that's being prioritized are healthcare workers that come in symptomatic, because if they're positive, we don't want them to go back into the healthcare setting and expose other healthcare workers. That could be devastating, and our first responders as well. And then anyone that the provider believes is residing in a congregate living facility, and it would be again very important to know if someone's is positive for COVID-19, for example, in a skilled nursing facility, so they can get isolated, and the staff can protect themselves with PPE.
Thank you.
Thank you, Joe, and thank you, Dr. Moreno. I have another question for you, Dr. Moreno, that's come through chat. Dr. Moreno, you mentioned on Wednesday that you're considering new public health orders and that you're meeting with County Council about them. What is the status of those potential orders, and what are you considering?
So I am looking at, what am I considering? We are considering the health officer orders that were initially signed in the Bay Area. Other counties like San Luis Obispo, San Benito, and Santa Cruz all issued, shortly after those orders, issued their own orders. They're very similar. And I have had conversations with the health officer from Santa Cruz County, the health officer from San Benito County, and the health officer from San Luis Obispo County. And we're all in concurrence that we need to have more strict orders in place. So, I'm hoping that we can get an order out by the end of today for the public and for our essential and non-essential businesses, so they know where they stand in terms of doing their part to protect all of us from COVID-19, to protect our vulnerable populations from complications and dying from COVID-19, and to protect our healthcare system, to minimize the duration of time that they are overwhelmed because of COVID-19.
Thank you, Dr. Moreno. Does anyone have any other questions? I have no more questions in chat. Does anyone have a question who's on the line?
Just to quickly clarify the order that he was talking about, what exactly will that entail?
Sorry, what was the question again? I apologize.
You talked about doing an order later today, just being more specific about that order.
I
Right. So
think you wanted to ask what it would entail.
Right. So it would, what I'm hoping is that this will provide a little more emphasis on employers having their employees work from home. It will should provide more restrictions on social distancing because of what's happening in the counties north of us, because we know that there are asymptomatic people who are in fact transmitting COVID-19 to other people right now in our community. As I mentioned, the modeling that's occurring in the Bay Area counties that have a lot more cases than us show that they're probably just a few weeks ahead of us, and without more restrictive measures in place, they believe that they will still be overwhelmed. So these orders are intended to, again, minimize the surge on our healthcare system. So it'll also, excuse me, clarify limitations on outdoor activities and other businesses like funeral homes and construction, residential moves, outdoor like gardening, landscaping, and will provide some guidance for businesses on how to implement social distancing in their essential businesses. So hopefully we'll be able to get that out this afternoon.
Thank you,
Thank you.
Dr. Moreno. Are there any other questions?
I have another question for Dr. Moreno. It's regarding wearing face masks while out in public. We seem to be getting conflicting guidance on that from the CDC. Is that, what do you think of the idea of people wearing face masks when they're out?
So yes, thank you for bringing that up. What I know is that there's, I think, at least one county, it might be Riverside County, that has recommended in some manner that their residents consider wearing covering their face. And my staff and I are really trying to word it that way so that we can distinguish that from face masks, which are typically referred to the surgical procedure masks that are used by our healthcare workers. So these are basically face coverings, or people may choose to cover their face. And what I've heard is that there might, or what this California Department of Public sent out was some guidance for all Californians who may want to cover their face. I think and I've read the guidance from the California Department of Public Health, and I'd like just to emphasize that anyone in Monterey County that chooses to cover their face needs to understand that by covering their face, really what they're doing is they are protecting others. And the reason is because, as I mentioned earlier, there are people in Monterey County who are infectious right now, who have absolutely no symptoms. And so if that person were to cover their face, then it could decrease the likelihood that they are going to spread the virus among to other people. The other thing that's very important to know is that if someone chooses to cover their face, they still have to adhere to all of the social distancing orders that I and the governor and the state health officer have put into place, because it's not considered effective enough that a person can go out while they're sick, and it does not replace social distancing. I think it's very, very important that people do not get a false sense of security by covering their face. They still have to stay at home and only go out to provide essential services or receive essential services.
Hello? Hi? Hello?
Adriana, is that you trying to speak?
Yes. I have a question, Dr. Moreno, specifically for the farm workers. What will be the recommendation? Because there's a lot of concern. What would be your advice? Should they wear them? Should they don't? Are they very exposed working every day? What is your perspective? Thank you.
Right. So thank you, Adriana. I think we were really hoping that Henry Gonzalez could get the audio working. I would like to, I don't want to speak.
Can you hear me now?
Yes. All right, Henry.
Oh, great. Sorry about the technical difficulties. Too many options to consider, for me anyway. So the question, the issue of workers wearing masks, it's a very important one and needs to be addressed. I've been going out into the field and making observations. Of course, those workers that are working as a tractor driver, as an irrigator and such, they work alone. So there's no problem maintaining social distance. Social distance is a problem when the crews are riding in the bus together or harvesting in front of a machine or behind a machine. In other situations when they're harvesting in a crew, just the fact that some are more able will separate them, even though they're harvesting one in each row. They'll separate and can maintain social distance. But with the machines, it's much different. And my observations are that they're not maintaining social distance all the time. In the case that I saw that I'm referring to, the workers were provided with masks by their employer. Some of the crew members were using bandanas at their preference, I was told, but they all had the masks in addition to rubber gloves, hats, long sleeve shirts, long pants. But I'm not sure if that is sufficient for them to protect themselves from the virus. All of the companies have been meeting amongst themselves and together with other ag company staff to try to figure out what to do. There are many different situations, and the ones that are clearly not needing to use protective equipment is fine. The more difficult situations are the one I described with the machine and when they're on the bus. So the crew that I inspected today, the company was taking 10 workers at a time and having them spread out within the bus in order to maintain social distance. The crew that I saw here earlier this week that was harvesting behind a machine, they were not, but they were wearing masks. So I think the companies themselves, as we all are, trying to figure out what to do and what is enough, and that's kind of where we are. We have been making recommendations together with our supervisors Alejo and Lopez and some of the Ag Industry Association representatives. We put together the advisory where we're making these recommendations. But some of we're essentially following the recommendation the CDC has put forward, but there's no specific recommendations for the use of masks in these situations. Part of the complication, I believe, is that these are essential workers. They have to go out there and work, and not in all situations can they maintain that 6 feet. They're working on it. One of the recommendations for the situation where they're working behind the machine, each worker in a row, shoulder to shoulder, working with 24-inch beds, they cannot maintain 6 feet. They are wearing the mask, but one of the recommendations is that they skip a row. If they skip a row, then they have a greater distance between them, and it would just require the companies to make 2 passes over the same field. It's less efficient, but more protective of the crew. So I'm happy to take questions if there are any in regards to my observations and what's happening out in the field.
Thank you, Henry. Does anyone have questions for the Ag Commissioner? All right, seeing none, are there any other questions
I'm sorry, Maya, I have questions.
All right, thanks. Go ahead, Pam.
Yeah, so is there any, Henry, any chance that the advisory seems very voluntary? Would you consider making it mandatory at some point?
We have thought of that, and as you know, I believe creating laws, regulations, even under emergency orders, it's a process, and it takes a while to create those rules, and the rules should be based on the science. What is the risk to a tractor driver? What is the risk to an irrigator? What is the risk to somebody in the bus that has to be looked at in order to avoid creating new rules that only make things worse. For instance, we have about 55,000 workers here in Monterey County. Providing each one of them with a mask would further negatively impact the shortage of masks. And that would be 55,000 workers, a new mask every day for the rest of the season. I don't know that those masks are available at those levels. So we really need to be careful in creating rules. We want rules that work and that apply to the situation, and that takes some time. Now, the private industry, they are much more agile than government, and they can just look at a situation, come up with an analysis recommendation as to what to do, and that's essentially what we did with this advisory. Now, from our part, creating that advisory, it is only that. It is advice to the industry that these are some measures that we believe they should implement at their respective companies. Now, the companies, when and if they adopt those measures, they can enforce these measures. They can mandate them. They can make it their company policy, and then it has some force. But perhaps we should study these situations with the workers, and maybe not all of them. The irrigator all by himself, the tractor driver all by himself, maybe we don't have to look at that because it's obvious that they have the ability to maintain social distancing. But in the buses, in their private vehicles, when they're working with a machine where they're stuck to the machine, they have to keep pace with the machine. Those are the situations that need to be looked at. I'm not a healthcare provider, so I'm a bit reluctant to say, oh, you can do this and you're fine. I can't do that. I believe the companies are doing that because they on their own, again, because they are agile this way, they are coming up with their own solutions. I'm confident that they realize they must protect their workers because without their workers, they can't harvest, they can't stay in business. So protecting those workers is critical, and they know it. But what they don't know, I believe, is all of the different ways that they can protect their workers, what is necessary and what is not.
Thank you, Henry. Are there any other questions?
Mayor, can you hear me? This is Paul Miller from the Pinecone.
I can. Thank you, Paul. Go ahead.
Great. I have two questions for Dr. Moreno. I want to get those in before he has to leave at some point.
Go ahead.
Okay, Dr. Moreno, first of all, thank you for the additional information you've been providing. It's a big help. Two questions. Why is such a high percentage of the people with positive results in Monterey County young? Can you give us some insight into that? And also, among the people who have had positive test results, are they dispersed in the county? Are they concentrated around a few points? Or are there, and also, are there any signs of any supercells developing in Monterey County? Thank you.
Sure. Okay, so let's see, looking at the data. So we do have a little bit of data. So 45% of individuals that test positive are less than 34 years of age. I don't have any explanation for that. Again, the numbers are small, but we do know is that what I suspect is that most of the people who are being prioritized are being I'm sorry, not most. Some of the patients that are being prioritized to receive tests are healthcare workers and first responders. And our healthcare workers and first responders tend to be in a younger age group. So because of our priority testing, I think we're getting more of a younger group out of the healthcare sector and out of first responder sector being tested, as opposed to other age groups. So that's probably one of the reasons why we're seeing, at least in Monterey County, under our current prioritization system for testing, it appears to be more folks in the younger age group.
Paul, does that answer both your questions?
Oh,
no, not the second one.
Supercell, sorry. So,
And just also, are they dispersed in the county, or are they focused in a few communities? Or, I mean, you're not giving much information to people to know if something has happened in there within 5 miles of them. So I'm just wondering, are these cases collected in a few spots, or are they dispersed? And are there any signs of any super cells?
So most of the population lives, a large percent of the population lives in the Salinas area, and that's where we're seeing 51% of the tests coming back positive, followed by the Peninsula area and South County. And I think so do we have supercells? I don't think we have supercells, but we have our outbreaks throughout the county. And many of these outbreaks some of these outbreaks are due because people are not following the social distancing rules, not because of where they live, it's because their behaviors. So we've had people that are having large group gatherings, even though they're not supposed to, large group gatherings, and then one person tests positive, and now we have a very large contact investigation going on. Again, it's not where they live that determines where the cases are, it's the people's behaviors. And so the virus is throughout the county, the virus is everywhere, it's out there, and people need to adhere to the shelter-in-place order and practice social distancing.
Thank you, Dr. Moreno. Are there any other questions?
One last question. Mayor, one last question for Dr. Moreno.
Sure, go ahead.
Going back to the masks, you had mentioned, the masks will protect others from that individual, not necessarily protect the individual from others. If that individual, and I know these are in short supply because they're mainly in medical use, but if someone did find themselves in possession of one of those N95 masks, which are as valuable as gold these days, would that give them two-way protection from others and protect others from themselves?
Okay, so thank you. So when I was talking about face masks, I was talking about face coverings, people covering their face. So that would be with a homemade a piece of cloth, and then they use some string of some sort and make their own masks, or they go online and buy face coverings, or they can cover their faces, partially cover their nose and the mouth with bandanas or scarves. So those are face coverings as opposed to face masks, which refer to surgical masks and N95s that are used in the hospital. So the California Department of Public Health's guidance on this refers only to covering your face with a piece of cloth, for example, or a scarf or a bandana, not face masks. In terms of N95s, people should not be wearing N95s unless they are, let me back up. Really, the only people that should be using N95s are individuals who are working with suspect or known COVID-19 patients. And those N95s are specifically made to filter out viral and bacterial pathogens. There are N95s that can be purchased or I don't know if they're still available, but they were available at department stores, for example, and building supply stores. And many of those N95s filter out 95% of particles, but they're not designed to filter out 95% of pathogens like bacteria or viruses. So I would say it's really not recommended, not a good idea for people to wear N95 masks when they're unless they're caring for somebody who has COVID-19, like a healthcare worker or suspected COVID-19. The other thing is those N95s restrict your limit and does put restriction on your availability, your ability to breathe, to exchange oxygen and carbon dioxide in the breathing process, because they're tight-fitting. They can be tight-fitting, and so there are some people who may not do well with the N95. Someone who has heart conditions, who has chronic lung conditions, and they require oxygen, they're easily short of breath. These individuals could actually harm themselves by wearing an N95.
Thank you, Dr. Moreno. And I have a call, I have a question that came in through chat. This for Henry Gonzalez. Are you aware of any decrease in numbers of farm workers coming to work and any concern that there will be not enough workers in the coming weeks to harvest or plant new crops?
There has been a scarcity of farm workers for a number of years. so much so that the ag industry has had to tap into the H-2A program to bring in workers. So with the border being blocked, there is certainly that reality that some of the workers didn't make it across the border in order to come work. We're going to have to wait and see on that. The harvest season is really just starting to kick into full gear. July is our peak season. So right now we have an early spring. So haven't really seen that, but that is a big concern. Of course, with any of the workers becoming ill due to the virus or anything that looks like the virus, that's an additional concern, because where they might have toughed it out with some symptoms before, the employers are not going to let them work in the field with other workers if they're showing symptoms. So they would lose those workers. The H-2A workers, because the employers must provide housing for them, and they're housing them generally in groups, they need to, and we're working with the ag companies on this issue, is trying to locate other housing areas, perhaps the fairgrounds, in case or for when the workers start to get sick, and they're going to want to separate those sick workers from the rest of the workers so that they don't infect them. So that is also an issue, and of course that would also impact the availability of the scarce workers, because the H-2A program takes so long to generate workers. That's not a real option for new workers to come in. That has to be done months and months and months in advance. So if there is additional shortages, it's going to impact the ability to harvest. And the only alternative when that happens is you just don't harvest. You leave some in the field. There is no other option at this point. Where do you get other workers is the question.
Thank you, Henry. And then there's a follow-up question to that, which maybe you might be able to answer, but we may also forward to social services. Is there any aid for farm workers that cannot work due to childcare issues or caring for family members, either through government or possibly employers?
I'm not aware of such assistance for workers. Having been a farm worker, I can just imagine that when and if something like this happens, they'll have grandma watch the kids, or if they don't have a grandma available, they may opt for one of them to stay home with all of the kids that they know within their respective family group. But I'm not aware of any specific fund for this. Many of the farm workers, anywhere from 50 to 75% of them are undocumented, and so they wouldn't even be eligible for many of the government programs, if not any of the government programs, which is really ironic that they are determined to be functioning in an essential business, conducting critical work for us to feed us, and yet they can't tap into any of the government programs.
Thank you, Henry. We have about 5 minutes left we're 5 minutes before the hour, 1 o'clock. Are there any final questions for any of our county participants?
Matt, it's Joe Sadowski at the Californian. A couple quick questions for Dr. Moreno. One, once you get that second machine at the lab up and running, how much will your testing capabilities expand? Also, regarding the order that you're expecting to release later today, will that lead to additional businesses or other organizations having to close or reduce their hours significantly?
All right. So as far as the order, let's see, the order actually until what I can tell you is that it's going to provide clarity as to which businesses were instructed to close after I issued my last order. We started getting a lot of calls, and we made some decisions on interpreting my order. This order provides, has more detail based on questions that came into our department. So that provides additional clarity. It provides, and it will result in some businesses having to change what they're doing and how they're providing services. So without getting the details, the answer to that second question was yes. And your first question again, I'm sorry.
My first question was just once you have that second testing machine up and running in the lab, how much will that expand your testing capacity?
6 times. We would, once we get that test, if we get that test, we would need to have I think we need to have additional staff to run the test, because we've maxed out all of our employees in the laboratory at this time with the current machines and equipment that we're using. But we can run probably up to six tests an hour, I believe would be reasonable if we had all the supplies and all the staffing that we need.
Thank you, Dr. Moreno. And we're close enough to the hour that I've got to let some of our county staff prepare for other meetings. Thank you for joining us on our media briefing for today. And our next briefing will be on Monday, April 6th. And see you then.
And you've been listening to the Monterey County Coronavirus Task Force meeting.